Happy New Year, good people. The year is still new and we've not met this year. So today we shall be looking at a topic that is quite common, but many a times you find that individuals normally shy away from seeking medical assistance, which should not be the case. So in case you have this condition or you know somebody suffering from this condition, this video is for you. Stick with me till the end. So welcome back, good people, to Community Medicine, a channel where we discuss matters health. So if you're new here, kindly don't forget to hit on the subscription button. You can also help me to like and to share this video. So our topic is hemorrhoids, commonly referred to as piles. So hemorrhoids are actually swollen, inflamed veins in the lower rectum and even in the anal region, and they're normally associated with anything that would cause an increase in pressure in the venous system around the lower rectum. So there are several risk factors to developing hemorrhoids, or there are several factors that would put one at a risk of developing hemorrhoids. For example, standing or sitting for long durations. Then you have chronic cough from conditions like maybe untreated tuberculosis, allergic cough, asthma. So what happens is that this chronic cough would cause an increase in the intra-abdominal pressure, or an increase in the pressure within the abdominal cavity, and this pressure would transmit to the rectal veins. We have frequent lifting of heavy weights. We also have chronic diarrhea, chronic constipation, and just like with chronic cough, these factors also would lead to an increase in intra-abdominal pressure, thus put you on at a risk of developing hemorrhoids. And then you have pregnancy and childbirth. Remember, with pregnancy, with the growing uterus, there would be an increase in pressure within the uterine cavity. So the beauty of this is that once the pregnant mother delivers, the hemorrhoid would actually get resolved. Then you have consuming a diet that is low in fiber. When you look at a diet that is high in fiber, you're looking at a diet that has a lot of fruits, vegetables, grains, and whole cereals like maize, whole wheat, brown rice, millet, sorghum. Yeah, so something else is individuals who don't normally drink plenty of fluids. And then you also have individuals who normally sit in the toilet for a long duration. Sometimes you find that individuals will go with their phones to the toilet and they'll take a lot of time as they're scrolling. So what really happens is that since the bums, for lack of a better word, are not supported, or rather they are suspended, this would cause a lot of gravity in the anal region, and this would in turn lead to an increase in pressure in the anal region. Something else is individuals who normally engage in anal intercourse, they are also at a risk of developing hemorrhoids. Something else is obesity, and then we also have leading a sedentary lifestyle. So these are individuals who rarely exercise. Yeah, so hemorrhoids are divided into three types. You have internal hemorrhoids. These ones are found inside the rectum. They are not visible, like you can't see them and you can't feel them. However, in case of straining or any irritation, they may protrude on the from the anal canal. Yeah, and internal hemorrhoids normally present with fresh bleeding. Like you'll find fresh blood after passing a bowel movement. Rarely do they present with pain. And then you have external hemorrhoids. These ones are found on the surface of the anal region. They are normally painful. Rarely do they bleed. They normally present with a lot of pain and itchiness. Actually, they normally feel like lumps. You can feel the swelling, which is like a lump. Then you have thrombosed hemorrhoids. These are external hemorrhoids with blood clots that are formed in them. This is due to pooling of blood in the external hemorrhoids. Yeah, so for internal hemorrhoids, we have several stages, actually 4 stages, depending on the severity. So with stage 1, the hemorrhoids don't prolapse, so they just remain in the rectum. Then with grade 2, the hemorrhoids normally prolapse during straining, maybe during a bowel movement, but they normally go back on their own. Then you have 3rd-degree hemorrhoids. These ones normally protrude during straining, but they don't go back on their own until they are pushed back. So 3rd-degree hemorrhoids have to be pushed back. Then 4th-degree hemorrhoids normally protrude and they don't go back even if they are pushed manually. So they remain, hanging around the anal region. So that is all I have for you for today. But I'll be doing another video on management of hemorrhoids. So make sure that you subscribe and make sure that you put on the notification button so that once the video is ready, you will get notified. Thank you so much for your time, and bye-bye.